Hi, in this video we have an opportunity to chat with Father Shyju Thoppil, the CEO and the Managing Director of the Lourdes Hospital, the premier multi-speciality hospital in Ernakulam, Kochi. Welcome Father. I am Mridula M Nair from Datamate. So Father, I want to ask the first thing, what was your role as a CEO and the Director in the Lourdes Hospital? What was your journey in the Lourdes Hospital, sir?
Yeah, Mridula, I started my service at Lourdes Hospital as an assistant director in the year 2006. Now honored to be here, especially in an institution, because as a diocesan priest, we dream to become a parish priest, and parish ministry is something which is very enjoyable and fulfilling. But the Archbishop asked me to come to Lourdes Hospital, and I came and fell in love with it. They were forced to, but I enjoyed each moment of it. And for the last 6 years, been at the head of the institution. It has been a very tough journey because of COVID and other things. But fortunately, with God's grace, we have done well. I must thank my team, the management, the doctors, nurses, paramedics, even the housekeeping, sanitation department people who really did wonders here, especially in these moments of crisis. Now, it was unprecedented, and we were under fear in the beginning of COVID. But that was a very great learning experience for me, to see how people are committed, loyal to the institution. And as CEO, my role was actually to motivate them, inspire them, and to keep up that level of enthusiasm in taking care of the patient, who is our ultimate, we are responsible for that. So, of course, we got the hospital, the college, the training centers, international training centers, and another hospital. So all these institutions were, we were working as a team, and that is something very wonderful. When you see around more than 1,500 people working with one vision. So with our motto, love and service, and the vision of excellence in healthcare, manifesting Jesus' love and service, giving his life to humanity, and we really enjoy doing that. And you asked about my role. Yeah, I told it is actually to inspire people and to motivate them. But from the day-to-day affairs to the strategic planning, all these things comes under my purview. At present, now we are 8 priests here with more than 200 doctors and of course more than 600 nurses and other service providers. So around 1,500 staff altogether. It's a big task to keep them enthusiastic and active every day. We work 24/7 and we stay in the hospital, and all these 16 years plus I've been staying in the hospital. So that is and still I'm healthy. Then of course we need to plan for the future, and planning has always been the part of the management, and as CEO we had to spend a lot of time in that. And I did learn a lot from the people, from our customers, from our vendors, from the industry experts. I was fortunate to be associated with the Catholic Health Association, AHPI, then the government bodies of Industrial Relations Committee. You remember that in 2012 we had the nurses strike.
Yes, sir.
We never had a strike here in any of our institutions, in Lourdes institutions, because it's a family. In family you don't strike, and even if you say something, it is till the evening, till night. So it has been like that. So So I was fortunate to have such a family atmosphere here. So that's why I said I fell in love with it.
Father, can you provide an overview of the hospital current operation and the service we provided?
We have almost all medical and surgical services in modern medicine, it is allopathy. We have from family medicine to neurosurgery, even the deep brain stimulation surgeries, from anesthesia to interventional pain management, what you call the arthroscopy and plasty surgeries. So surgical, medical, all these except radiation oncology, all these facilities are available in Lourdes. And we cater to the very poor people, like people in the peripheries. We go to them actually. They don't have to come to Lourdes. Through our family medicine clinics, even to the Tandoli, which is very close to the city, but we like to go by Thoni, Tan Thoni. You have to have your own boat or vanchi for that, to go to that. So that kind of a place where people are really in need. They are also our customers, and also the high profile people like judges, the industry leaders. They all enjoy the service here. Because basically we started a small nursing home in 1965. So, and nursing was something very unique for the strength of Lourdes. It has been and it will be. Because of the committed service of our Reverend sisters. We started with Maria Bambina sisters, Sisters of Charity. They are still here. So they are leading the nursing service department, both service as well as education. So it is under their care. So we have very committed, dedicated nurses. Now from 80s, it became a specialty hospital with all the specialty services, and from 90s it became a super specialty. So now it's a multi-super specialty teaching hospital. So we cater to all kinds of disease profile, all social strata, but we have a preferential option for the poor. That doesn't mean that we have people coming from the Arab countries, the Maldives, even the European countries. So they come here for treatment, specific treatments. And in specific departments, we have well-known experts. So sometimes we allow them to go there also to practice. So that kind of a relationship is there. And I have around 15 centers, outreach centers in and around the Ernakulam city. So every day we go there. So the poor, the rich, the marginalized, the high profile, everybody is taken care of. Those who seek the help, that will be given. Except radiation oncology, all the services in modern medicine are available here. And in Krista Jayanti, we have Ayurveda, which is our sister concern under my directorship. So there we have Ayurveda. And in Lourdes Health Center, which is sort of OP services, we have even homeopathy. So we give an integral care of the human person, not just disease. We have to treat the person, right? So not the disease. Of course, we have to take care of the person and person as a whole, including his family, his social situation, because then only the treatment will be complete. And of course, we give a lot of importance to the preventive health. So we have health education programs, school health programs. So you take any instance where healthcare is required, we are there. So we call something Lourdes at your doorstep. So Lourdes is not only in this institution, it is in the hearts of the people at their doorstep also.
Father, can you tell us about your sister institution and organization of Lourdes Hospital?
Lourdes actually functions under Lourdes Society for Healthcare and Research. Lourdes Society for Healthcare and Research is under the aegis of Archdiocese of Ernakulam, the mother of Catholic Church in Kerala. We have Lourdes Hospital, the first institution, and we have another hospital, that is Shyju Augustine Hospital, that is in Vipin Islands.
Okay.
That was a gift to the Vipin Islanders in 2000, Great Jubilee 2000. So that is why it is called Shyju Jayanti. So that is a 40-bed hospital, again NABH certified. And we have another institution in healthcare, that is Lourdes Health Center, that is at Cheranallur. We have our College of Nursing at Chembumukku, on the route to Kakra, where we give BSc Nursing, post-basic BSc Nursing, MSc Nursing, degree programs and postgraduate programs. And there we have the School of Nursing, which we started in 1969, so already Golden Jubilee year is over. So there we give General Nursing and Midwifery, GNM program. So more than 500 students are studying there. Every year around 160 students pass out from our nursing institution. Then we have a paramedical college where we train paramedics because now healthcare has become very techno-savvy, right? So you need technicians and they are given specific training, say in neurology or anesthesia or dialysis. So you need properly trained, skilled personnel. So we have a college for that. And in all these educational institutions, now what we are finding is all our students are everywhere, all over the world. So wherever you go, you can find a Lourdian. That's a great thing. And sometimes people, when I say I'm from Lourdes, they come. So it is to say that yeah, they have very good memories about the institution. They love the institution. I'm fortunate to be part of that institution, and because of my predecessors and the teachers, the wonderful teachers they had, they still remember with love. Then we have an international training center under American Heart Association, giving training to the doctors and nurses for the ACLS and BLS programs, that is Advanced Cardiac Life Support and Basic Life Support. Also we give PALS, and that is Pediatric Cardiac Life Support, and NALS also, neonatal. So these are our training programs, and along with Lourdes Hospital is a postgraduate medical institution. So we have in 11 subjects, we have postgraduate medical students studying here. Now at present I have 71 postgraduate residents here. So we used to have 100, now it is only, we have restricted the numbers because earlier we had a lot of people, residents coming from North India. We were finding it very difficult actually because of the language
issue.
So now it is restricted, and now it is only Malayalis are there.
Okay.
So because we have to take care of the patient's level of education also, because communication is the crucial thing in healthcare industry now, or healthcare ministry. So these are our institutions, and all these institutions under the Lourdes Society for Healthcare and Research is so Archbishop Joseph Kalathiparambil is the president, myself is the secretary, and we have a treasurer, and there is a governing board of the society which governs all these institutions. So that's how we have been organized.
Can you walk us through some of the milestones Lourdes has achieved over this year?
Progress or the milestones, it happens every now and then, I would say. Because in healthcare, the progress is very, very rapid. So, advancement in healthcare delivery is to be implemented in healthcare service providers also. But then we were always concerned or keen about the quality of service. So that's why we started with the quality initiatives. So we were the first to recognize that the baby-friendly hospital. It was an initiative by UNICEF and WHO and the IAB. So we were the first to be recognized as the baby-friendly hospital in Kochi, and UNICEF representatives came here to give that award. So that was one of the big milestone in the history of Lourdes. We were actually right from the beginning, of course, since it is mission hospital, lot of deliveries. I remember when I joined, we had no place to put the patients, and we had to take the beds from the even discarded beds also, take them and put in the corridor to keep to accommodate the patients.
Okay.
Now, of course, we can't do that, but that was in 2006, and that was a time when the hospital was, it was all mainly general ward. So people love to be in general ward. Now nobody is there in the general ward. They want private rooms. So that is another change that I have seen. But then when we focused on the quality of care, so the next thing came was the NABH, or the National Board of Accreditation, National Accreditation Board of Hospitals. So NABH was, we said it is only a step or only a milestone. It is not the end of our journey of quality. So we started that quality drive in 2012, and we were the first to achieve the NABH accreditation among the mission hospitals in Kerala, so in 2015. So after that we could motivate many hospitals to achieve that accreditation. And I still remember I was taking sessions for these administrators, and they were saying, what is the use of this? I said, it is actually, now if you have a passport or a birth certificate, then only you can say you are an Indian. You can say an Indian, but you don't have a proof. When you say you have quality, you need to have a proof. So that is only through this accreditation process. And of course, it streamlines the process and streamline the process for improvement. So once you start measuring it, you can improve. If you don't measure, you can't improve. So that is why we went for the accreditation, and we were the first to get accredited in the mission hospital sector. It is very difficult because we started in 65. At that time, it was all what you call the Nightingale ward, and the infrastructure was enough at that time, and it is not a very planned hospital. As and when the situation demanded, we grew and we built. So that is how it was developed. So it was very difficult, but joyfully we journeyed through that, and NABH, then NABL for the microbiology. Then something which came recently was the there is a campaign, Eat Right Campus, under the Ministry of Health, and we were the 5-star rated hospital in the city of Kochi. I think we were the first one to be recognized as a 5-star hospital canteen. We don't call it canteen; it's a dietary and diet hall. So then, of course, the Viga Icon Award for the affordable healthcare, and even at this highest quality possible, we have beds for 10 rupees. So that's the level of affordability that we offer. But that doesn't mean that we don't have the deluxe rooms and suite rooms. It is always there. But we have to cater to the poor people also. And especially now when everything is costly, and the cost is going skyrocketing. These kind of institutions are very much needed for the society. If the society is not keen on this, then after some time we will not have this kind of a institution and service quality. So then customer service awards by RTI. So these are all awards and milestones in the journey of Lourdes. But these are actually not very important for us. What is important is the smile on the face of the patient when he goes from here. That is actually fulfilling. And the folded hands of a parent when the child is cured and going. So that is something which we enjoy, and that's the most satisfying thing.
Father, can you discuss the hospital staff training and the development approach?
We have a culture of training. It's a culture of learning actually. So training programs is a common thing and is a mandatory thing. Starting from the nurses, because they have continued nursing education. CNE programs are a mandatory thing, and every month every nurse will have to undergo one training minimum. So it may go up to 2 or 3, but one mandatory training is compulsory for all the staff nurses. And that's the way to improve healthcare quality, right? And the training programs are not only routine things, but occasionally we keep training programs specifically for managerial training for the administration of wards, for the head nurses or the department heads. And every month we have one training session for all the staff.
Okay.
Then of course we have a training calendar prepared. That is very important, and that training is imparted either from HRD, that is Human Resource Development, or from the individual departments. And there is a training and development committee also which monitors all these training programs. So training is a culture that is here, a culture of learning, and that is why Lourdians are respected when they go out from here. Because when they go out to, especially the European countries, that's why they have come, the Europeans are coming here actually. We have affiliations with European countries for the staff recruitment and staff training. So that is because they have seen our staff are well trained and confident. That comes out because of this training program, which is a regular feature. At that time they don't enjoy it. I mean, they don't appreciate it, but the moment they go out and they see how well they can respond and respond to the situation, and the appreciation they get from their employers, then they are very happy.
Father, do you have any suggestion for other hospitals that have an automation of medical document and process in program?
Don't be disheartened by the delays and hiccups. It is a process thing, and you have to overcome it, and you will be able to overcome it if you are persevering in it. So perseverance is the thing in automation, and perseverance is the thing with the Datamate also. Because for the last 22 years or 23 years, happy that Datamate is associated with Lourdes and Lourdes is with Datamate. Yes, of course, there will be issues unique to each institution. You have to communicate it and get the people to the field, to the ground, and see what is happening, and then they will be able to solve it. The problem most of the time what happens is doctors will say something, the technicians will not understand fully what it is, and they will do something, the technicians will make a convey it to the software developers, they will do a program that will not be accepted, so there will be a lot of delay. So what is important is let them sit together and communicate. So what is there, the idea has to be communicated, and it should be effectively understood. When I say effective, it is 100%. So if an idea is there in my mind or in doctor's mind, that has to be communicated and it has to be retold by the technician or the software developer, so that the doctor says, okay, this is what I want. Then it will be easy. Then only it will be possible. So persevere in this, and it will be a tough thing, but the fruits you can enjoy.
Father, what are the advantages of adopting HIS, ELIDAR EMR, and what are the challenges did you face when migrating the platform in a brownfield hospital project?
Yeah, that's a very good question. It's a tough thing, and managing the people who were here even before I was born to adopt to this technology was not an easy thing. So what we did was we made it mandatory actually, yes. But we knew that it is not possible for the seniors. So we gave them physician assistants, especially the doctors and the nurses, and I would say the other class of staff. They were very open to this automation thing. Now with ELIDAR, doctors were a little reluctant in the beginning. So we had to again give training sessions. It is actually through training only you can convince them, and once they are into it, they start doing it, they start enjoying it. So initially, that is a Malayali problem. So we have always this starting trouble. No? So once you start it and then you made it run, then yes, they start enjoying it. Now the situation is such that if something happens to the system, if there is a system hang, then the hospital also is stopped. We can't function. So it's a good thing, but it's a challenge also. It's a big challenge. So we had to train and make them adapt to this. The one problem that we faced, especially in the counters, because our numbers are high. The brownfield hospital, the issue is the volume of patient is high. So it was difficult. Even now, it is very difficult. Even after this many years, it is not that easy. Seeing 100 patients in a day and entering the details, it is not possible for one doctor. So we had to give additional doctors, additional hands, sometimes physician assistants, sometimes clerks, sometimes typists. So depending on the need, we provide the supportive staff. Then with the counters also we had issues because the big queue was there. People they start queuing up at 7 o'clock in the morning. Even we have for taking the chart. Even though we have telephone booking, even though we have app booking, even though we have the website booking, all these things are there, but still people queue up with their mobile smartphones in their hands. Still they don't use it. So delay in printing, it is not the system delay, it is the printing delay was causing a problem. So we had to make some adjustments and customize it. So these things, small little things, but small little things, it contributes to the customer delight. Yeah, because they don't want to wait. Nobody wants to wait. So these technical small things created a little issue in the beginning, but I'm very happy that Datamate could solve it in time, so that now it runs smoothly.
Father, while I'm coming inside the hospital, I have seen the robot parking. What was the purpose?
Yeah, in Kochi, parking is a big headache.
Yeah, that's true.
And Lourdes is actually, as I told you in the beginning, Lourdes is an institution which grew over the years. So it is a horizontal growth. The buildings are horizontally placed, not vertically placed. So there is no parking space actually, not enough parking space. So I had a tough time, and there was a lot of discussions happening. We had discussion with the experts in the field, and at last we decided to go for robotic parking because it saves a lot of space, which is precious for us. And the automation in that also will help reduce the cost in maintaining. So we had to evaluate all the facilities available, and we narrowed down to one particular company. And it's a beautiful thing, and I've seen that in many European countries, and I'm very happy to have one of such a huge one actually. It's 129 cars in that space. Now we are actually putting 4 more floors to that to make it 200 plus. So that is actually again the technology helping institutions like us to manage and to bridge the gap between the need and the reality. So that is why the robotic parking is there.
Thank you, Father, for cooperating us and giving the answer of these questions. Really, I am very privileged to have to serve with you, and we all Datamate, we all very thankful to have such a nice time with us. Thank you, Father.
Thank you. God bless.